while we've been reacting to this crisis by saving lives today, we're also simultaneously thinking about what we need to do for tomorrow to reopen up Los Angeles, to get back to school, to get back to work, to get back into public spaces, and what we need to be able to do that safely. Yesterday, Governor Newsom, along with his counterparts in Oregon and Washington, unveiled thoughtful and necessary goals that are required to reopen the economy. These steps zero in on testing, preventing infection among high-risk groups, hospital capacity and the ability to handle surges, the availability of therapeutics, medicine, and vaccines, adoption of physical distancing measures in businesses and schools, and the ability to kind of snap back to reinstitute safer-at-home measures when necessary. We need these clear guidelines in place to restore a sense of normalcy and prepare for a second and even potentially third wave of COVID-19. Consistent with Governor Newsom's approach, I want to take a second tonight and share with you 5 pillars of our strategy that we're considering here and talking to leaders across the country about in order to return to good health and to more prosperity in Los Angeles. First is testing. So we all know, but it is a critical requirement that we have widespread testing for everyone with COVID-19 symptoms and for also asymptomatic people with significant risks of transmission. There should be strong national standards for the quality and the reliability of tests and federal support to guarantee supplies are affordable and available at the local level. Now remember, when we're talking about testing, we're really talking about 2 different kinds of tests. First, virology tests, which are the ones that are conducted usually with a nasal or a mouth swab to detect the presence of the SARS-2 novel coronavirus that can confirm whether somebody may be infectious with COVID-19, whether they have symptoms or not. This helps us track and trace and isolate people as well as their contacts so they can be quarantined. And then the second type of tests are serology or blood tests that draw blood from a finger prick or a syringe to detect the presence of antibodies that have been produced in reaction to the presence of the novel coronavirus. These antibodies can tell us who has had this coronavirus or COVID-19 and assess their potential immunity or track and trace people they have come in contact with because we didn't know that they were sick. These blood tests are the easiest way to see how many people have had the presence of the novel coronavirus, but do not, I repeat, do not necessarily, as Dr. Ferrer has said many times, speak to someone's infectiousness. Virology, the swab tests, if you will, are better. They are a point-in-time test. Serology is really a historical test. And serology tests still have a way to go to be produced en masse and with close to 100% reliability. But we know that they will be critical in the steps ahead. We will need this strong system of testing before LA will be safe to reopen. Second, real-time surveillance is needed for us to be able to detect and prevent new outbreaks. We need to link test results to a surveillance network so COVID-19 can be tracked in real time. We can quickly detect new hotspots, maybe quicker than a human eye can see them. For instance, an outbreak in a neighborhood or a senior care facility. So we can quickly go to the third pillar, immediately respond to new cases with even more aggressive approach than we have today. This is about building a greater ability to quickly isolate cases, trace and communicate with contacts, and quarantine non-immune individuals who have been exposed to COVID-19. Doing this means some workers will need to be trained for urgently needed new jobs to supplement the incredible work being done by our public health professionals. We've seen in San Francisco, librarians, medical students get enlisted. One estimate is that 300,000 Americans, many out of work who could potentially have new jobs like they're doing in Boston right now, can help make sure we track and trace more quickly and more extensively. Fourth is the question of hospital capacity. This pandemic has laid bare our hospital bed shortage. We shouldn't have to scramble like this. And here in Los Angeles and California, luckily the actions we've taken and the great work by our hospitals to expand that capacity has let us keep up with the increasing demand of patients in our hospitals. But we need a national push to grow the capacity in ICUs, emergency rooms, and supplies like PPE now before the next wave hits. And then fifth, the last piece is ongoing research and development. Our country, and certainly this region, has a remarkable history of being innovators. That's how I started my speech tonight. And we know that top scientists with federally backed research can help develop treatments in universities like USC and UCLA here and throughout the country. We need to make sure that treatments and vaccines and cures to terrible diseases in the past, that brilliance is put here as it is being done for COVID-19. And we need the CDC and others to support standardized data collection and to closely collaborate with states, universities, and labs to effectively develop treatments, not based on theories, but on actual clinical trials. And then to share that information with doctors and nurses on the front lines. These 5 principles are the principles guiding us here in Los Angeles, as we will make those decisions about how and when we can begin to get back to work and back to school, back to fun, back to the life that we had before all of this. But together with the key measures our governor outlined and that we are exploring, namely how do we keep protecting those high-risk members of our society even as we open up parts of it, are going to be very important in the days ahead.